today we've got an incredible talk coming along online. We've got Dr. Paul Clayton and Cherie Gorringe that's going to explain to you some of the key things about, the real thing is about cellular function. And today's a very special talk about understanding where we're at with the technology available today to give the best possible cellular structure within a human body. Cherie, if I could hand it over to you to host the call, that would be truly appreciated. Thank you, Cherie.
Thank you, Rob, and hello, everybody. Great to have you here on the call, and we really appreciate you making the time in your schedule. We know we're going to give you some fantastic insights today, and I'm really super thrilled to be joined by two incredible men who are really dedicated game changers in our wellness industry. They are super dedicated. So Dr. Paul Clayton and Mr. Rob Hawkins. So I'm going to intro both these beautiful gentlemen because they are extraordinary. Dr. Paul Clayton, our VIP guest, he's currently based in Florida at the moment, but usually he's tripping all over the countryside, lecturing to thousands of people. Dr. Paul Clayton graduated as a medical pharmacologist from Edinburgh University prior to obtaining his PhD, and he's dedicated more than 40 years, making it his mission to re-educate as many people as he can around the serious public health matters that we as practitioners are only too familiar with these days. A former chair of the Forum on Food and Health in the UK and senior scientific advisor to the UK government's Committee on Safety of Medicines. He's currently a fellow of the Institute of Food, Brain and Behaviour at Oxford University. He works with leading doctors and clinical scientists at centres of clinical expertise in many countries, designing and supervising preclinical and clinical trials of pharmaconutritional interventions. So Dr. Clayton's books and ebooks include Health Defence, After Atkins, Natural Defences, Out of the Fire, and Let Food Be Your Pharmaconutrition. It's amazing. So our second guest, Mr. Rob Hawkins, COO of Zenzino Australasia and leading health business coach. Rob regularly assists top medical practitioners all over the world, and today he's going to be generously sharing his decades of insights around ways to bolster your business and thrive in these current uncertain economic times, as we all know is fast approaching. So we're very privileged to have you both on the call with us today, and I'm super excited for the opportunity to have this deep dive around the topic of cellular flexibility. So thank you so much for joining us. Dr. Clayton, I'm going to start with you. We've got about an hour on this call, so I was hoping that we could start asking you a few really pivotal questions and deep dive into the cellular flexibility topic. So you've written several books on the topic of chronic inflammation. Why are we seeing so much chronic inflammation and disease in our modern society? And even though we have access to so much knowledge and research these days, why is this, and what's the most effective way of dealing with this problem? Over to you, Dr. Clayton. Are you on mute?
So now I'm no longer mute. Well, first of all, I'd like to dispel this idea that I'm some kind of hero of the nutritional resistance. I'm not. I'm simply a clinical pharmacologist, one of many, who has been working in this area of natural pharmacology. I was probably one of the earlier ones. And I've written a few books, published a few papers, and I've had the opportunity of working with and learning from a lot of people who are experts, deep experts in narrow fields. Now, I'm not that. I'm a generalist. My knowledge is very broad, but it's relatively shallow. So a lot of the work that I do is collaborative. And when I write, and some of you may have seen my blog at drpaulclayton.eu, it's very often they're collaborative pieces. So when I do a piece on Parkinsonism, I talk to the people, the experts in Parkinsonism. When I do something on Alzheimer's, I'll talk to the people who specialize in that kind of dementia. When it comes to chronic inflammation, that is one of the areas that I have gone into in much more detail, and I do have some expertise there. And really, my interest in this topic started with a series of papers I published in the Journal of the Royal Society of Medicine, where I and a colleague looked at the relationship between dietary shift and changing patterns in public health. And it became very obvious to us in the course of our research that public health had reached a high point in the period 1850 to 1898 in England, which is known as the mid-Victorian era. It was a period when, if you're very granular and you look at socioeconomic equivalent groups now and then, it's pretty obvious that their men were healthier and lived longer than we do today. At that time, men lived longer than women did. This idea that women are intrinsically longer lived is something of an artifact. In the 19th century, the opposite was the case, and some of the changes that we've seen, the improvement in life expectancy for women, has really been brought about by innovation in the fields of contraception and obstetrics, largely. But for men, things have gone backwards. We've actually lost life expectancy, and over the last 4 or 5 years, we've seen life expectancy starting to fall back again in the United States, in the United Kingdom, and in vulnerable groups in many other countries as well. This is largely due to an increase in chronic degenerative disease. And if you haven't all been living under a rock for the last 25 years, you'll know that at the heart of chronic degenerative disease, you have something called chronic inflammation. Briefly, the modern diet causes chronic inflammation, and at the same time, it causes type B malnutrition. What this does is to accelerate the destruction of the extracellular matrix and slow and reduce your ability to repair it, which means you become catabolically dominant. Over time, there is a net loss of this matrix. And it is this matrix that gives you basically structure and therefore function. It's your soft skeleton. It's what holds your cells together so they can function collectively. There are other things that contribute to the aging process. Mitochondrial senescence, people talk about immunological senescence, telomeric shortening. There's a host of other things as well. But for most people, the bulk of the aging process that they see personally and that we experience clinically is due to this decline over time of the extracellular matrix. That is what contributes to the development of osteoporosis, the development of osteoarthritis, the aging of skin, the increasing erosion of the linings of your arterioles, and a host of other degenerative pathologies. Chronic inflammation has become terribly important, and we see that because almost all of the chronic degenerative diseases have steadily increased in frequency since that's about the 1950s, and their latency has on average decreased. So we're seeing more of these healthcare issues, and they're occurring in progressively younger groups of patients. That tells us that we're dealing with a population that is being in some way chronically intoxicated, and chronic inflammation is at the heart of this. I don't want you to run away with the idea that chronic inflammation is the be-all and end-all. It's not. It's a very important part, but the modern lifestyle also causes dysbiosis. It also causes accelerated immunological senescence. And it also leads to insulin resistance. So it's this combination, these sub-mechanisms that collectively are driving the multiple pandemics of chronic degenerative disease that are basically causing our healthcare costs in all the OECD nations to spiral out of control, and increasingly too in India and China and all the other parts of the world where our terrible Western diet and lifestyle is being infiltrated. So chronic inflammatory stress, what is it that causes it? Well, I'm sure about tobacco, that causes chronic inflammatory stress. But tobacco aside, and fewer of us are smoking than they used to be, thanks in no small measure to legislative action taken by various governments. Chronic inflammatory stress is by and large caused by the modern diet. Now, the modern diet is increasingly consisting of ultra-processed foods, thanks to very aggressive marketing by a relatively small number of global multinational food manufacturers. What these ultra-processed foods have in common is that they're calorie-dense but nutrient-light, and in particular, they've been depleted of some of the most important anti-inflammatory nutrients, which include, this isn't a comprehensive list, but the most important ones, are the long-chain omega-3 polyunsaturated fatty acids, the polyphenols, the prebiotic fibers, and that's really all to do with inflammatory stress or its absence in the gut, and compounds called 1,3,1,4 beta-glucans that are absolutely essential to the normal functioning of the cellular components of your innate immune system. For all kinds of reasons, these compounds have been removed from ultra-processed foods. So 4 major anti-inflammatory constituents are gone. And what the food companies give us in return, in exchange for this, they give us foods which are extraordinarily rich in advanced glycation and advanced lipoxidation end products. And the reason why their processed, ultra-processed foods contain large amounts of these is because the multinationals, in order to make the foods as cheaply as possible, have to make them very rapidly, which involves high temperature processes such as spray drying that you do not use at home. So many of these foods will go through rapid and quite extreme temperature shifts. They're complex formulations. Under these conditions, age and ale formation is accelerated, and you find very high levels of these in most ultra-processed foods, up to and including infant formula. They also, especially in the latest generation of minimally processed vegetable foods, so these are salad packs, pre-cut and pre-portioned fruits and vegetables, which we buy for convenience sake. These also have been shown to contain extraordinarily high levels of lipopolysaccharides, another deeply, intensively pro-inflammatory compound. And that is a microbial issue, because these packs are not sterilized, and even at low temperatures in the fridge, you see this under cold chain conditions. You see a progressive slow growth of various gram-negative species, which are coated with lipopolysaccharides. So the anti-inflammatory compounds are gone, 4 of the major ones. 3 exciting new forms of pro-inflammatory, I won't call them nutrients, but toxins are being poured into our diet. And that really is an overview of why the modern diet creates so much chronic inflammatory stress. Now, there is more to it than that. The extraordinarily high glycemic load of the diet contributes to this, because that combined with the physically inactive lifestyle, highly inactive compared to our historical norms, leads to insulin resistance and glycation reactions taking place in the body, creating further inflammatory stress through the age-rage sequence. So it's a perfect storm, really. I mean, a lot of these things are going wrong together. Cumulatively, they are driving chronic inflammatory reactions. Now, we all need to be able to mount inflammatory reactions, of course. It's part of our natural defense against microbial invasion or against physical trauma. And you need to be able to switch it on and then switch it off once the threat has been minimized or reduced. And it's that system of checks and balances, which, if you're well-nourished, works very well, keeps you safe from acute threats, but doesn't cause chronic problems. But that set of checks and balances is totally off balance. It's totally out of balance. It's constantly being driven. It's not being braked. And so we end up with the public health problems that I listed before.
Oh, that's excellent, Dr. Clayton. So you regularly focus on re-educating practitioners around inconsistent efficacy in the essential fatty acid-based research. So from what you're understanding, what's the missing link and what's the solution to this?
Well, I mean, it really depends on how I interpret your question. In some ways, the missing link is the fact that the doctors are absolutely brainwashed by a medical cause that consists exclusively of synthetic pharmaceutical technology. And which I understand, because the medical schools are to a large extent funded by pharmaceutical companies, not exclusively, but it's an important source of funding. And post-qualification training is almost exclusively funded by pharmaceutical companies. And they have no interest at all in teaching doctors about natural pharmacology, or a more evidence-based nutrition is another way of describing that. So that's one reason, one particular missing link. And that has historical reasons. That goes all the way back to 19th century finance, which some of you may know a little bit about, but I won't go into that now. Another part of the missing link is that even although we have a plethora of evidence which documents the anti-inflammatory activity of omega-3 fatty acids, the long-chain ones in particular, when we put them into clinical trials, they don't work. I mean, the whole thing is a wash. It's a confidence trick. The Cochrane collaboration repeatedly looks at this question and looks at the totality of the clinical trials that have been done with fish oil. And every time come to the same conclusion. Fish oil has very little effect at all on cardiovascular endpoints, on neurodegenerative endpoints, on degenerative ophthalmological endpoints. I mean, you can go through the list. Yes, they will admit it might have some slight effect in neurodevelopmental disorders, in reducing symptom scores, in having some effect in certain types of depression. They will concede that. But for the rest of it, it's a complete washout. And this is very puzzling because there has consistently been a lot of epidemiological evidence showing that eating fish is good for your health, and in particular eating oily fish. And that goes all the way back to the work of the Danish physiologists Bang and Duerberg with their work in Greenland and the Inuit Islanders and their marine diet. So you have two data sets here that are very difficult to combine. They don't seem to coordinate in any reasonable way. It's healthy to eat the food, the fish, or the marine mammals, in the case of the Inuit Islanders, but when you take the fish oil, it doesn't have any effect. And this is, I think, a huge riddle at the heart of modern pharmaconutrition, and it's one that I tackled with a rather good Hungarian scientist, I think five years ago now. We wrote a paper from alga to omega, have we reached peak fish oil? And what we developed in this paper was the idea that what is so important in fish is the omega-3s, yes, but not just the omega-3s. A fish, a whole fish, contains all kinds of interesting nutrients. And because Bang and Duerberg had been very influenced in their thinking by the pharmaceutical model, they assumed it's got to be just one thing. And they've selected the omega-3s as that one bioactive molecule. And they were partly right. They were half right, but they were totally wrong, because what it is in the fish that is protective is a combination of omega-3s and lipophile polyphenols. Specifically, lipophile polyphenols called fluorotannins. Now, the fish don't make omega-3s. They're produced by the organisms at the base of the marine food chain, which of course are the marine algae. And just as terrestrial plants produce omega-6 fatty acids, it's the cold water marine algae that produce the omega-3s. And for these omega-3s to get into the body of the Inuit, the apex predator, you have to stop and think a little bit about this extraordinary journey that these fragile molecules must make. The algae are consumed by krill. The krill are consumed by pelagic fish. The pelagic fish are consumed by larger fish, marine mammals, and then finally, you've got the Inuits. And this is a long journey, which can take over a year, and it's going through at least 4 or 5 trophic levels, in some cases more. How can you reconcile that with the fact that these omega-3s are such fragile molecules? The omega-3s are so fragile that if you take an omega-3 capsule and prick it, pour the contents into your hand and do that, in 30 seconds, you can smell that it's starting to oxidize. They break down really, really quickly. How on earth could the omega-3s travel from the marine algae all the way to the apex predator? And the answer is very simple. The same marine algae that produce these omega-3s also produce an antioxidant and a chaperone molecule called fluorotannin. Now, fluorotannin is a condensed polyphenol, and it's rather atypical. Most polyphenols are water-soluble. They have limited solubility in alcohol. Very few of them are lipid-soluble. There's one other major source, and I'll get into that later. But these fluorotannins are what nature designed to keep the omega-3s sweet. If the omega-3s were to oxidize or turn rancid inside the algae would die. They'd be destroyed. So what happens is the omega-3, these fluorotannins, they bind extremely tightly to omega-3 fatty acids. And they co-migrate with them, they co-partition with the omega-3s through the entire marine ecosystem. You never find the omega-3s on their own. They are always bound to these polyphenols all the way through. So as the algae is consumed by the krill, the omega-3 polyphenol combination goes into the stomach of the krill and into its tissues. When that's eaten by the pelagic fish, into the stomach of the pelagic fish and into its tissues. And so on and so forth, all the way up the chain, until you come to the human predators. And we know that these lipophile polyphenols are extraordinarily effective chaperones and antioxidants because we've tested this working together with SINTEF, which is a Norwegian governmental organization. And we've shown, or rather their scientists showed, that when you take the omega-3s and expose them to oxidative stress, if you're using tocopherol, for example, which is not what nature designed, if you're using succinyl ascorbate or astaxanthin or any one of a host of other antioxidants, the omega-3s break down pretty quickly, within a few hours. If you use the lipophile polyphenols, you find that the omega-3s obstinately remain intact for 36 hours, and the tests don't run any longer than that because the lab techs say, we've had enough, we're going home. It's really, really effective, unlike any other antioxidant we have ever really looked at. So I just want to repeat the idea that you never find omega-3s on their own in nature. They are always accompanied by these lipophile fluorotannins, and you can see that even in the body fat of the INWIT. If you cut an INWIT open, and you're going to have to get ethics committee approval to do that. I only know this because I've actually stood by in operating theaters and actually seen for myself what they look like from the inside. Their body fat doesn't look like the body fat of an Australian or an American or a French person. Our body fat is classically pale cream, might be a little, slightly very faint yellow. If you've been eating lots of carrots or eating beta-carotene supplements, you can stain yourself orange from the inside. But that's not what the body fat of an INWIT looks like. Theirs is brown. It's brown, it's tinged with brown. And it is the same brown color you find in the brown marine algae that are producing the omega-3s, because fluorotannin is brown. So the fluorotannins are a fantastically good chaperone molecule, which is why we find in our library of cell membrane samples, which is what we do work on together with VITAS, this independent third-party academic and commercial analytical laboratory that works with the World Health Organization. What we find is that when you take omega-3 products on their own, the omega-3s break down before they're delivered into the tissues. And people actually usually, even if they've been taking omega-3s religiously for their whole lives, and Scandinavians do this, they still have terrible 6-to-3 ratios. If you take the omega-3 polyphenol combination, you reliably and very consistently bring the 6-3 ratio down to 5-to-1 or less within 120 days. And we've seen that repeatedly. So the polyphenols are really, really important. They're as important as the omega-3s, but they do two things in the body which are quite distinct. The first is that they are the chaperone that nature basically designed to do the job. But because they're polyphenols, they're pluripotent molecules. Polyphenols are really a fascinating group of phytonutrients. And they do many, many different things. But one of the things that they do is they block COX-1, 2, and lipox-5 and 8, but they also downregulate the genes that express for the matrix metalloproteases and inhibit the matrix metalloproteases themselves by binding to the divalent metal cations that all of these enzymes have at their active sites. So by adding the polyphenols to the fish oil, you're reconstituting the oily fish, basically, or the marine algae. And you're delivering the omega-3s to the peripheral tissues, which is very, very special. But once the omega-3s and the polyphenols get to the peripheral tissues, the polyphenol then adopts its second role, and it acts in the inflammatory cascade further down. So while the omega-3s are tipping the balance of pro and anti-inflammatory mediators, increasing your formation of protectins and resolvins and nice things like that, which are anti-inflammatory, further downstream in that cascade, which actually culminates in the release of cathepsins, proteases, and matrix metalloproteases, the polyphenols are now coming in and switching off that lower part of the cascade as well. So you get a super additive anti-inflammatory effect. I could go on at length, but I would only say, first of all, these polyphenols are so good at stopping the oxidation of omega-3s. They're now being used to preserve fish in Iceland and parts of Norway because they preserve fish much more effectively than any other type of antioxidant that has been used up until now. But we decided not to use them, even although they're really effective, because not everybody likes the taste of seaweed in the morning, or indeed at any time of day. So we swapped them out for the analogous lipophile polyphenols derived from olive, which basically are doing the same thing. And we've shown that they're doing the same thing. So we have a fish oil, olive oil combination. And thanks to some superb food technologists, and I mean, there's a whole group of people who've been involved here, but I'll just mention one name, Linda Sand, who did some really good work with this. The overall organoleptic properties of this oil are actually very good. Now, if you ever drunk Muller's Tran, which is your basic fish oil, is consumed all over Northern Europe, I mean, it'll bring tears to your eyes. It's really appalling. And I think people drink it really out of a sense of guilt and duty and desperation. Nobody does it for pleasure. I can assure you that compared to that, the Balance oil tastes positively pleasant. And I've seen the film clips that Zinzino puts out of people drinking their oil and saying, they wonder how delicious, as if it was fine wine. It's not that good. I don't really enjoy drinking it. I'd rather drink a cold beer or a cup of hot tea. But if you're going to drink fish oil, the Balance oil is about as good as it gets.
Oh, that's so fantastic. And you touched on the Vitas Independent Laboratory. For those people that haven't done this before, can you just touch on how we look at the data that comes through from that laboratory and why it's so valuable, and maybe even take that through to the cellular flexibility topic that we're talking about today?
Right. Well, I think there's no point in recommending a nutritional program unless you can test for it. I don't want to recommend nutritional input to someone who doesn't need it. I don't want to medicalize people needlessly. I really don't think that's good practice. So we use something called the Balance test, which was developed not by us, but by various scientists at the University of Trondheim and Rome and I think Naples, and is published. It's in the scientific literature, and it's run by various independent laboratories. The lab that we tend to use is Vitas, which is very well regarded. It's actually on the university campus at Oslo, and it works for a lot of blue chip organizations, including the World Health Organization. It's completely independent. It's third party. And when people send their dried blood spot samples into them, what they're doing is using very beautiful and automated test systems, which will give you a printout of your fatty acid profile in your erythrocyte cell membranes. Now, this is important because you could measure plasma lipids if you want. A lot of people do, but I don't think that's very accurate or meaningful. It can be extremely misleading, because your plasma lipid profiles will change from day to day and almost from hour to hour, depending on your last meal. They're very kinetic and variable. When you look at the cell membrane constituents, that is a snapshot of a much longer period. It will give you meaningful information about the ratio, your overall intakes of different fatty acids over the last 3 to 4 months. So to put that in context, the relationship between cell membrane lipid profiles and plasma lipids is very similar to that between HbA1c and plasma glucose. That's what we measure. We have a library of, I think, close to 600,000 samples now, growing very rapidly. And it's the largest tissue bank of its kind by far in the world. And increasingly what we're seeing is that the biobanking community is coming to talk to us because they would like to use our database. They've begun to realize that the people in the Zinzino family are, in nutritional terms, unlike any other population that they've ever seen, with health outcomes that are unlike any of those that they have previously seen either. So we are now starting collaborations with some of the most senior biobankers in Europe with a view to collating all of our data and to determine its prognostic value. Now, we know from the tens of thousands of cases that we've accumulated that as your 6-to-3 ratio starts to decline, we will typically see a reduction in the intensity and frequency of clinical symptoms attributable to chronic inflammatory stress. So that, for example, essential hypertension will decline and become normotensive over those 4 months. Skin lesions, which are predominantly inflammatory, will decline over those 4 months. A whole host of other pathologies driven by chronic inflammation will go into decline and can be measured not only in terms of the reduction of symptomatic intensity, but also require a reduced dependency on pharmaceuticals. Now, we've accumulated a lot of case histories, but as you all know, that's the lowest level of clinical evidence. I would not want to rely on that. And we're now moving forward to conducting a prospective, double-blinded, placebo-controlled and randomized trial of essential hypertension, established essential hypertension. I think it's either 200 or 250 subjects. I'm not quite sure which. I think we're aiming for 250. And that's being done at the leading academic research center in an EU member state. I'm not at liberty to tell you which one. Recruitment has started. We should be in a position to publish, I would think, by the end of Q1, maybe Q2 of 2021. And if you might find this amusing, I'll just tell you that the active is balance oil and the placebo is standard fish oil. Because fish oil doesn't work, we know that. And we're going to light a bomb, a fuse underneath the fish oil industry, which has been getting away for far too long with selling snake oil. That'll be fun, I think. I know that they know what we're doing. I know that they're extremely concerned about it. When I first published this paper, where we looked at the involvement of the polyphenols, I was attending a lot of conferences at that time, going to the fatty acid conferences, amongst others. And the reception, I was getting such a hostile reception. I was getting screamed at in some cases. And once I was almost forced to leave the conference room by representatives of fish oil companies who felt that what I was doing was discrediting the entire industry. And in fact, I think I was trying to do that because it's a confidence trick. It's a fraud and should be out of business. So in general, my general point is, if we're going to move from nutrition to evidence-based nutrition, we must be transparent. We must have tests associated with that which show what's going on so the consumer can see what's happening rather than simply taking it on faith. Those tests must be conducted by an independent third party that is not owned or connected to the company that is selling the products. That is the way to move this industry forwards. And we're establishing that principle. We've established it with balance oil. We're developing a similar test for Xenobiotic, which is a prebiotic blend. Another test again, which will be attached to Viva, which is this natural antidepressant anxiolytic. And a fourth test, which you'll be able to use at home for the effectiveness of Extend, which is our nutritional Swiss Army knife that contains everything up to and including a little bit of kitchen sink.
Oh, that is so fantastic to hear, because I think when I got involved with Xeno, I saw the clean, simple, easy protocol that we could offer people. There's a beginning stage, there's a sort of an end and ongoing stage where we can actually measure. So as a practitioner, that was really valuable to be able to show people the journey that they were going on. And I had actually in the past run a lot of these Omega testing for a much higher price, for a lot longer in terms of waiting for test results, maybe up to 6 weeks from the US. I just found this Norwegian company is so sophisticated and so professional, and has people attached to it like yourself that are really changing the way that we're viewing this particular type of information. My question around that is, you know, I think a lot of practitioners are primed, particularly in Australia here, to actually go in with like a quite heavy supplement regime. And my understanding is peeling it back to the foundations and actually re-educating practitioners around priming the cell to receive that nutrition, because you know, they could be spending hundreds of dollars on these supplements and it's actually not getting to where it needs to get to. That's why I've sort of made this type of testing one of my primary tests that I go in with. What's your view on that? Why is this test sort of being the starting point. Is that how you see it as well?
Well, nutrition is not, above all, it's not a linear science. It's like a forest of information and variables, and you can start almost anywhere in that forest, and there are so many different paths through it. Zinzino started with balance because historically that was where they entered the nutritional field. And it's a reasonable start point, because if you have a good 6-to-3 ratio, it's telling us something not just about your tendency to inflammatory stress or not. It's actually telling us a little bit about the overall quality of your diet. Not completely accurately, but it is a guide to that. I would say that it doesn't really tell you anything about, for example, immunological functionality or senescence. It doesn't tell you anything about insulin resistance. It doesn't tell you anything about dysbiosis. You need to use different tools to measure, to get an idea of whether those problems exist, and if they do, how severe they are. With dysbiosis, and I think that everybody's getting progressively more interested in this because we're beginning to understand now it is the key, not simply to gastrointestinal disorders, but also to a whole range of other pathologies, including the major neurodegenerative conditions. And if, for those of you who are interested, if you go to my blog, drpaulclayton.eu, what you will see are a couple of recent pieces where I've looked at the role of dysbiosis in Parkinsonism and Alzheimer's. And in both cases, there's a really interesting and convincing story to tell. And I've given a lot of references to you, so anyone who wants to look at that, you can jump off into the scientific literature from there. But dysbiosis is something that we can't look at using the balance test. We need a very different way of looking at that. And so I've been working together with some analytical chemists, and we've come up with another tool we can use to measure it. Now, you could do a second-generation sequencing of the entire microbiota, or at least that percentage of it that you can identify in culture. But the fact is, even though that's wonderful academically, most of the time we don't know what it means. There is such microbiotal diversity. And frankly, we don't know the importance of many of these species. When various numbers, various colonies, species go up and down, we don't know what that means. You know, the Bacteroides and the Firmicutes, we know they're important, the Clostridia are important, but there are so many subgroups within each of those families, and we don't know what they mean. And also there's a lot of metabolic overlap, so when one population goes down, there's evidence that other populations come in and take over many of the roles of the species that's gone AWOL. So, yeah, academically interesting, very interesting, but how significant is it clinically? Not so much, or at least not in a way that we are very clear about yet. I wanted to know whether the contents of the large bowel were predominantly anti or pro-inflammatory. Once they're pro-inflammatory, you start getting tight cell junctions opening up, you start getting permeability issues, you start getting CURLI formation, and then that starts moving up the vagus nerve, and all kinds of things start going wrong at that point. You don't really want to do that at all. And so what you need to do is to flip the microbiota over from being predominantly gram-negative, which it is today because of the modern diet, to being predominantly gram-positive. Now, gram-positive species can also be pro-inflammatory because they contain peptidoglycans and various other compounds in their cell walls that are capable of triggering inflammation. But the nice thing about the gram-positive species is that particularly the ones that are capable of using prebiotics as a fuel source, they don't invade the mucosal layers. They stay in the lumen of the gut or the outer mucosal layer. They don't come into contact with your colonocytes, and they are not pro-inflammatory. And in fact, because they're producing large amounts of butyrate and some other really interesting compounds, they're highly anti-inflammatory. So I came up with the idea that it might be pragmatically more useful, rather than finding out all the different species that are there, to simply find a way of measuring the ratio of lipopolysaccharide to butyrate. Modern diet, gram-negative dominant, lots of LPS, lots of inflammation. Put your prebiotics in, more butyrate is being formed, and as the gram-positive species are growing, they're killing and crowding out the gram-negative species. So with the LPS butyrate ratio, we've actually got this to work in a prototype format in the lab. And what we are going to do next is to find ways of simplifying this, streamlining it, automating it to the point where with every jar of product of xenobiotic, we can include a standard fecal sampler, which is a tiny vial with a loop. After you've gone to the bathroom, you take this tiny, tiny sample, seal it in the vial, put it in the envelope, send it away, just as you do with the blood spot now. And after 2 or 3 weeks, you go online and you get your result from this third-party laboratory. And we can document that as you take this blended prebiotic, the contents of the large bowel switch from being pro to anti-inflammatory. And as they do, what we see in practice is that symptoms of IBS and IBD start to go into remission. And a host of other good things happen too. I'm not really very much in favor of using these interventions as monotherapies. And you all know, I think, being part of the therapeutic community, that monotherapy is primarily a pharmaceutical concept, even though it's not actually honored in practice. We know that in nutritional terms, when our customers, clients, patients come to see us, they typically have multiple metabolic abnormalities or imbalances driven by multiple nutritional compromises. And my feeling is, because in the 21st century, our people are coming to us with type B malnutrition, with chronic inflammation, with dysbiosis, it's best dealing with all of these major problems. This is mostly what we are now doing in Europe. We've really moved in that direction. And what we see is that in the majority of cases, in between 8 or 9 out of 10 cases, chronic health issues become much less, or they go into remission. Not in every case, because clearly there's at least a hardcore of 10% where you've got major genetic risk factors, and those we cannot address, at least not with these tools, although we're very interested in looking at them. But the bulk of the most important healthcare issues of the day are amenable to our tools.
Thank you, Dr. Clayton. That is, that's what really got me excited about Zenzino is test-based nutrition. So in my learnings over the time, I've learned that healthy cell membranes operate optimally at around about minus 70 millivolts. And when that flips polarity, that's when serious disease can manifest. Can you explain the mechanisms of the cell voltage, the intracellular and extracellular matrix differences, and what are the key nutrients that sort of drive that voltage, and how do we lose the ability to hold that voltage?
I'm not sure that I completely agree with the question. I mean, the electrolytes are all very well known. The primary electrolytes that are involved in maintaining it, this minus 70 volts, are sodium and potassium. But you also have to include chloride, calcium, magnesium, phosphate, and bicarbonate. And there's a couple of other sort of rather odd minority components that are playing a role here too. Now, yes, we do know that this cell voltage, the transmembrane cellular voltage, can sometimes alter. We know that it is altered in certain very specific diseases, Duchenne's muscular dystrophy, cystic fibrosis, where you've got problems with some of the ion pumps. But by and large, the cell maintains that voltage pretty well, and if it doesn't, it starts to die. Now, there is one exception, and those are cancer cells, and they seem to have rather different transmembrane voltages. But then cancer cells have got all kinds of irregular membrane functions, not just, the ion channels, not just the ion gates, but the way in which fatty acids are packed into their cell membranes appears to be differently as well. The way in which various protein groups and amino sugar, amino acid copolymers are embedded in the membrane are affected as well. For example, the C43s, I think, is it, or C49? C43s, the connexins, they're all differently expressed as well. So the issue with cancer cells is, I think nobody really knows, is it the cell becomes cancerous because the membrane, the transmembrane voltage has been altered, or is it which way is the arrow of causality flying? Is the change in transmembrane voltage due to the fact that the cell has become cancerous and its membrane has become somewhat disorganized? And I rather think it's the latter, although I can't prove it. under most other conditions, if the transmembrane voltage is starting to shift, that's indicative of the fact that the cell is dying. So yes, that's an important part of certain types of cell death. Whether it's an important component in driving any diseases other than the few that I've listed, I'm not so convinced. However, there are certain compounds, dietary compounds, that undoubtedly do affect the structure of cell membranes. And the omega-3s are one of them. And there's various other types of lipids which also have an impact. So some of these, for example, you can use to modify certain aspects of immune function. T-reg function can be altered by various lipid constituents in the diet once they're built into the cell membranes. As you increase the omega-3s in cell membranes, yes, they become more flexible, but also there is a change because you're changing the lipid matrix. There is a subsequent change in the configuration of various receptors that are embedded in the membrane and protrude out into the extracellular space. So, for example, as the omega-3 content of your cell membrane increases, we see an improvement in insulin sensitivity. We think because the glucose receptors and the insulin receptors are actually being slightly reconfigured. The part where they're embedded in the cell membrane is altering, even if it's only for a very small extent. And that's leading to secondary minor changes in the structure of that receptor in that part of it that's expressed in the extracellular space. Very small changes, but they do seem to have an impact. The other area where we do see the impact, and I know people talk about this theory of cells becoming better when their membranes are flexible at absorbing nutrients and removing waste products. I'm not even sure I believe in that. I mean, I know people talk about it. I haven't seen really good evidence for it, but what I have seen is changes in erythrocyte flexibility and changes in capillary blood flow and in capillary function. For example, if you spend a lot of time in operating theaters, and I have done it various times, you will see that someone who has a very good 6-to-3 ratio, who's been taking balance off, for example, is going to cause the surgeon various problems because they look very like the patient who's on aspirin. You cut into your operating site, and in a normal patient, you cauterize the major and minor blood vessels that are supplying that space, so you can keep it fairly dry. And you can see what you're doing. You need to be able to see where you're putting your scalpels, your retractors, and all the rest of it. In the patient on aspirin, you need to keep draining. You have to keep suction there because the patient keeps oozing into the wound space because it's coming through the tiniest capillaries. The same is true for the patient who's on high 6-to-3 ratios. And while this may be a problem in the surgical situation, in most other situations, it's extremely positive because you want better capillary perfusion. And what I have seen some evidence of is that not only is capillary perfusion improved, but the capillary bed standing wave is also enhanced. Once you've got blood cells, we are able to move more easily through that capillary network. So, I know that you wanted to make this talk all about cell membranes. I think they're a little bit peripheral. They do have their particular relevance in one of two areas, the areas that I've listed. But I don't think that should be our main focus. I'm sorry to disappoint the audience out there. That's what you wanted me to talk about.
That makes perfect sense. And in fact, we need to think outside the box because sometimes we just hear these things and we roll with them. And, it can be parroted all over the place. And we really need to put some constructive, critical consensus over all of this as well. So I really like the fact that you've brought that capillary perfusion up because it's an important one. More blood means more oxygenation, means more rapid healing, right? So that's fantastic. I recently had a friend who has recovered from a very serious blood disease. She had a successful bone marrow transplant. And when she was talking to her specialist, she asked the specialist, why are we seeing so much of this type of blood disease? And he said, it's because of plastics. What's your belief around that? And how do you think it actually impacts our blood quality? And, with this type of testing and the balance oil, would that be showing people how they're improving the quality of their blood to be more protective around that?
I mean, okay, that's a trick question because there's a lot of questions wrapped up into it.
Yes.
Do I think it's plastic? Actually, I don't. Plasticizers and various other organic compounds, many of which have arrived fairly recently in the space that we live in, and which have undoubtedly entered the food chain and have undoubtedly entered us, maybe making a contribution. But when you talk to the infectious disease specialists and the oncologists who have a particular interest in the leukemias, their current belief, I would say there's more than one, but the current dominant belief is that this is due to a failure to exercise the immune system adequately during the first year and possibly 2 years of life. And there's actually quite a lot of epidemiological evidence to support that. The people who advance that argument say that we have, through immunization protocols, through the progressive sanitation and cleansing of our food and water supplies, that we've reduced the frequency of infection in the population at large, and certainly in the youngest population. And if you go back 100 years, approximately 1 in 4 children died before the age of 5 of infectious disease. Infectious diseases were rampant, and you would expect to get, chickenpox and rubella and mumps and measles and a lot of other things, plenty of RTIs and all the rest. And we've rather pushed those back with various healthcare programs, which seemed like a good idea at the time, but which some of the specialists in this area now believe has left the immune system unchecked, unprimed, unbalanced, choose whatever terminology you want. And they think that that is the most important reason why we're seeing more of these leukemias. So perhaps one way of approaching this, if that indeed is the real story, and I have a feeling it may be, we should be dialing back on our immunization programs. I think it's a good idea to immunize against things like polio and diphtheria. I'm not convinced that it's necessary to vaccinate against measles, mumps, chickenpox, all of which I had as a child. And we used to have mumps parties and chickenpox parties, so all the kids would get it because we knew that would give lifelong immunity. Unlike vaccinations, which don't only give relatively short-term immunity and not as good. I don't think that flu vaccinations are worth it at all unless you are really very old and infirm, and then possibly. And for what it's worth, even if a COVID vaccine does come out, I'm not going to take it. That's my own personal choice.
Right. Glad you said that.
Yeah. I think we should let kids muck around in the dirt and get sick more often, exchange diseases, and I think that they would, in the long term, be healthier for that kind of experience. That's how building
a more robust immune system.
Yes, and then maintaining it, because the cellular components of the innate immune system have multiple nutrient requirements. These are complex machines, and they have a very wide range of requirements. But in particular, your neutrophils and macrophages, Kupffer cells, Langerhans cells, in order to work properly, they absolutely require 1,3,1,6 beta-glucans. Now, these used to be omnipresent in the food chain because yeast contamination is everywhere. Except after 1950, with the introduction of the synthetic fungicides and biocides in general, the agricultural sector became the agrochemical sector. The fields became a sort of a chemical war zone, and our exposure to these compounds has dropped away to almost nothing. And that is one of the factors that has led to very widespread immunological imbalance manifested in allergy, and probably autoimmune disease as well, although autoimmune disease is a much more complicated kettle of fish, and there's probably various ways in which you can develop autoimmune disease. So I would say that getting a couple of infections, or as many as you can, in the first few years of life is a good idea in general. But thereafter, your diet should include these 1,3,1,6 beta-glucans, and it should also include all the constituents that you need for LPO synthesis and function. Now, LPO is probably the single most important humoral component of the innate immune system. It's a heme, it's a ferroprotein, and iron depletion and deficiency is very, very common. It has two other substrates, iodine and isothiocyanates, and our intakes of both of those are falling. Iodine because we are avoiding salt, and the fashionable people are eating sea salt as opposed to boring old iodinated table salt. And our intake of thiocyanates is way, way down from what it was 100 years ago, again because of dietary shift, patterns of dietary shift. So this is an enzyme that's a really important part of the innate immune system that is multiply compromised. And by coincidence or not by coincidence, all of these cofactors and a whole host of other things are in our formulation called Extend, which got its name from disease X. Now, some of you may remember that in 2018, early 2018, the World Health Organization came up with this nightmare disease X. And this was a new zoonotic viral infection that appears from nowhere, Africa, China maybe, and has a high transmission rate plus high virulence, immortalized in cinema as the Andromeda strain. Some of you may have seen that. And I was thinking at that time, what is it that we could do to protect ourselves against disease X? And I started looking into great detail at the chemistry of our antiviral defenses. Now, whereas our antibacterial defenses are largely, not exclusively cellular, our antiviral defenses are largely, and not exclusively, chemical. Forget about NK cells, forget about B cells. The NK cells are not that important, to be honest. B cells only become involved quite late in the stage, and very often too late. Your key defenses against viruses are hydrogen peroxide, hypochlorous acid, hypothiocyanous ions, and hypoiodide. And these are four mild oxidizing agents, or bleaches, which the body makes in response to viral infections. They don't kill the virus. I'm not sure you can kill something that probably isn't exactly alive to start with. But what these compounds do is they degrade, they break down sulfhydryl groups, which all these viruses have on their surfaces. And once you've done that, the virus is then no longer capable of going through the cellular invasion multiplication sequence. As I said, when I looked at this dietary shift story, it became very clear to me that a lot of the things we needed to mount these antiviral defenses are incredibly low in most humans at this moment in our history. So Extend was designed to be an antidote or a prophylactic against disease X and a lot of other things as well. And all of these factors have been included in that. I also am just about to shoehorn another active into the next generation of Extend, which is a family of compounds, or two families, called fucoidans and funorans. I don't know how familiar you are with these or whether the audience in general knows these or not, but they are predominantly polysulfated oligosaccharides, or variants on that theme, and they are the natural equivalent of Teflon. They're anti-stick. And you find them in seaweeds, which is why, seaweeds are living in an incredibly hostile environment, full of potential threats, and they coat themselves with these compounds to prevent fouling, to prevent microbes and animals landing on them and parasitizing them or predating them. And it turns out that if you take fucoidans and funorans, hopefully, ideally from an edible seaweed, because some seaweeds are not edible for a very good reason, and you eat them, you absorb these molecules, they get into the bloodstream, into the saliva, they bathe the roots of the teeth, and they then prevent the buildup of plaque and tartar. And that's really good if you're worried about periodontal disease and you don't like going to see the dental hygienist and having the roots of your teeth scraped. But it's important in another area as well, and that is the area of prosthetic surgery. Now, a lot of surgeons aren't particularly aware of this problem because they tend not to follow up with their patients for more than 10 or sometimes 12 months. And they know about the problem of post-operative infection. which tend to occur, whether it's superficial or deep, in a relatively short period of time after the surgery. What we're now finding is that there's quite a significant population of people who received a hip or a knee prosthesis or a heart valve, and maybe 5 years later or 10 years later, they die. You find them, they're dead for no obvious reason. But when we cut them open, what we find is on the prosthesis, there is a lot of biofilm. There's a microbial infection there, and it's been pumping out toxins into the bloodstream. That's what killed them. Now, these prostheses are made of material that are biocompatible, but they are not immunologically competent. So 10 years after an operation, you go to the dentist, there's a transient bacteremia, bugs land on the prosthesis, they're sheltered. They grow, slowly perhaps, but this is now being regarded as a potentially very important late post-operative problem. And these fucoidones and funorans, if you're eating them, they stop bacteria sticking onto your prostheses as well. So that's actually, I think, just as important as the oral health issue.
Absolutely. Are you saying from that point that the prosthesis biofilm can actually drive a periodontal issue or vice versa, with the periodontal issue driving the low-grade infection in the body?
Well, let me tease those things apart. If you have a biofilm on the teeth, you either have periodontal disease or you're developing it. If you have periodontal disease, you have a dysbiosis in the mouth, you have chronic inflammatory stress there, you're releasing bacterial metabolites into the local bloodstream. What we know is that various compounds, including CORLI, and this is really important protein that is deeply involved in neurodegenerative diseases, then moves up through the olfactory nerve into the brain and starts the neurodegenerative disease. So the idea is that by taking fucoidones and funorans, preventing biofilm formation in the mouth, you reduce this problem in the mouth. But if you're eating these compounds, they're in the bloodstream as well, and they're also bathing not only the teeth, but any prosthetic device you might have implanted elsewhere in your body. And that's a good idea because you're preventing, potentially, biofilm colonization and really major problems in a hip or a knee or somewhere else in the body.
And if these prosthetics have been placed for a number of years and you start taking these nutrients, will they help to clear those biofilms, or is it really more of a preventative for when you go in to have that surgery? Yeah. It's better to have them there to begin with.
If I was going to go in to have a hip replaced, I would want to be taking 1316 beta-glucans and funorans and fucoidones and a bunch of other things before I even went into the hospital, because the hospitals are hotbeds of antibiotic-resistant bacteria. And a very good a microbial consultant, a friend of mine, who's one of the tops in his field, once told me that he had negotiated a deal with the surgeons at his local hospital where he was a consultant, that if he ever required trauma surgery or elective surgery, they would not operate on him in the operating theater, but in the hospital car park, which he considered was much safer.
Oh, I goodness, that's it.
Now, so I would say, yes, prophylactically, but suppose you've already had your knee and your hip implant put in and it's 2 years later or 5 years later, yeah, by all means, because once you take these compounds, they start getting into the biofilm and breaking it down. And you can see this for yourself. Most people have got plaque on their teeth. Once you start eating, you can see that using plaque disclosing tablets. Once you start eating fucoidones and funorans, the plaque starts to disappear.
Oh, that's fantastic. And this leads me to my last question for you, Dr. Clayton, because you've been really fantastic in sharing all this wisdom. You had a personal experience with this balance oil. Can you share, because what I consistently see with a lot of the people that I'm testing, particularly vegans, children and the elderly, very consistently they're out of balance. And it's quite scary. What's the sort of your experience of this for you personally? And we'll sort of close it out there and move on to asking Rob some questions.
Okay. Well, this is how I first got involved with this whole concept of balance oil, and this is quite a long time ago now. I've been going through a rather difficult period in my life, and I developed stress-related autoimmune disease, specifically Graves' disease. And being a typical clinical scientist, I make an awful patient, and I didn't even notice that I was skinny as a rake, and I was walking out in minus 10-degree weather wearing a t-shirt because I was really overheating. And of course I had Graves' disease, but I didn't even notice until one morning I woke up and I was in AFib. So I went to the local hospital, and they did all the right tests and said, well, you're classic Graves. I had all the antibodies and all the other symptoms. And they told me that, well, what we do, we'll have to remove your thyroid, and then you'll be on thyroid replacement hormone therapy for the rest of your life, which I really didn't like the idea of that. I don't like the idea of being medically dependent. And I wanted to see if I could stop this process by using natural anti-inflammatories, because when you have an autoimmune disease, your immune system is damaging its target through a process of chronic inflammation. And I had known about the respective roles of omega-3s and polyphenols, for a long, long time. So I started drinking enormous quantities of fish oil and olive oil. And it was disgusting, but I persevered until I noticed that I was bruising spontaneously because I was drinking so much fish oil. I was really drinking very large amounts. And in that respect, I was mirroring the experiences of Hugh Sinclair, who did some of the very first work at Oxford on omega-3s. He had a freezer in his lab full of whale blubber, and he would chew it religiously every day to see what the effects were until he started getting these spontaneous bruises. And that was nature's way of telling him to stop. And so then I knew my omega-3 levels were too high, and I should I didn't have the balance test, but I had that going for me. I could use that to measure where I was. And in a fairly short period of time, the symptoms of the Graves' disease went into remission, because my immune system just couldn't do any more damage to the thyroid. And I kept it at that level for several months. And then I thought, well, maybe the immune system has been able to forget its target, or it's been educated not to attack that target. Because I had an idea of the interactivity, the complexity, the feedback loops that are built into the immune system. And my feeling was, well, maybe it's forgotten its target, or it's been re-educated. So I stopped taking the fish oil and the olive oil, and I remained euthyroid. I wasn't hypo or hyper. I was, absolutely normal. And I have been for the last 12 years. I went back a couple of years ago to the hospital where I was screened, and I said, look, I don't think I have Graves' disease anymore. They went back through their files, and they said, no, you have Graves' disease. They did the bloods, tested me, and said, no, well, you don't have Graves' disease. What have you done? And I said, I was playing around with various supplements, and they said, well, we don't believe you. We don't understand what you did, but whatever you did, it was the right thing. Anyway, we've looked in the textbooks, and we found one other case of Graves' disease that remitted spontaneously. So it does happen. It's not common. It's very uncommon, in fact. But I'm pretty certain I know what happened in that case. And subsequently, I was really, really fortunate to make contact, quite by accident, with a group of doctors in Boston who were using the same approach to treat type 1 diabetes in young children with equally good results. Now, I don't know if this is always going to be effective. I think I may just have been lucky, and I'm not putting this forward as a validated therapeutic approach. It's not. This is just my own personal story. I would also say that I think there's different ways of getting into an autoimmune problem. There is this one idea that there is an infection, and then because of antigenic similarity between whatever microbe it was and something on the surface of the tissue that the immune system is attacking, that it's a mistaken identity. That's one model of autoimmune disease, but there are other models, one of which has been developed since the microbiota has been recognized. We used to think that most compartments in the body were relatively sterile. We know now that's not the case. There is not a single compartment in the body that is sterile. There are microbes everywhere, including in the blood, the brain, everywhere else. And some of them are intracellular. And there's quite a lot of evidence coming through now that at least some autoimmune diseases are not actually the immune system attacking the host tissue at all. They're actually trying to attack the microbes that are inside the cells and otherwise undetectable in those organs. And there's some quite good evidence for this. And one of those is that certain types of immune disease can be cured using rather intensive courses of antibiotics. That's a whole different story, and it's really, really interesting. I wish we had more time, but I'd like to talk about that because some really good work is being done in Poland on this, and I'm partly involved in that. But I suspect we've run out of time, and Mr. Hawkins probably thinks it's his turn in the spotlight.
That's fantastic, Dr. Clayton. I know that personally I've had thyroid patients that have been able to go off their medication when they've been using balance oil. So I think there is definitely something at play there. So I appreciate you sharing your personal story around that. And now it's over to you, Rob. I have a few questions for you because, you know, as a business owner, I had my own clinical practice for over 7 years. And, you know, it's always important to keep that business going because we're in the business of helping people. A lot of the time practitioners, they do just want to go out and help, and they hope that the finances will follow that mission that they put out there. But I want to know from you, Rob, because you've been working with a lot of top professional medical people. Why do you believe many of the wellness professionals are now leveraging a sort of a drop ship direct selling model?
Look, I think really, Cherie, it's all about that e-commerce model and cost of overheads, probably the key thing here. You know, the days of you guys being required to have thousands of dollars worth of stock or $1,000 worth of stock sitting on your shelf is pretty well gone. And also with the speed bump with COVID, it's now reinvented the whole world, okay? Not just the practices itself, but we're seeing more and more people. And I know myself, in 4 months, I've been in lockdown, okay? Lockdown that I used to travel and be everywhere. I've done my whole business over 4 months, the last 16 weeks, on Zoom. I've continued to grow a massive business, okay? Our products are an immune product, so they are on the tip of everybody's, you know, tongue basically at this point of time. So, you know, we're one of the fortunate ones, but the whole practice has changed dramatically where now I see doctors, I see naturopaths, I see chiropractors all doing video or Zoom calls to, you know, talk to their patients if they don't need to come in physically to be seen. So that's where the e-commerce platform has come into it very well, because literally I take on the role of, you know, basically looking after your patient, your customer on the supply chain, pick, pack and shipping an order for you that's been, you know, placed on the e-commerce model. No different to, you know, for an example, Amazon and all the other platforms that are out there. We're exactly the same. The only difference is I fund that side of the business for you. I have the warehouse. I have the customer support staff. I have the marketing staff. I do all that for you as an addition or an add-on to your business. So that's what my company's there for, to support that, and then pay a trailing royalty. I mean, you know, there's got to be some profit in it for you guys, and we make sure that there's a nice trailing rebate at the back end for connecting customers to our company.
Yeah, look, I know Zenzino is a listed company in Norway, and over there I believe that the direct selling model, they have really strict rules around having a strong customer base. How does this model work, and how does it help the businesses to grow like a rock solid, you know, integral income stream?
Well, the beautiful thing is that, yes, the direct selling world, or, you know, that industry is changing dramatically, but there are some front runners that have taken the the stance of let's make this a true customer model. And quick comparison, we have over 300,000 people consuming our product every day now that are placing orders on our company, on a monthly basis. So that's an automatic replenishment order system. And we have 10,000 professionals like we've got on the call today that are out there communicating our product. So we're not a rah-rah company. You won't see us doing the song and dancing and throwing the furs and the rings in the air. That's just not the way we are. That's not our company. Publicly traded, and we're held accountable to all regulations around the world. So we're there as a support chain to whatever practice or whatever wellness community wants to utilize our company and our services.
So can I just also ask you around the the ability to recession-proof your business? What are we talking in terms of numbers, in terms of, profitability for people, for practitioners particularly, using this type of model?
Well, I've been fortunate. I've been now, we opened the company last September, and when I saw this, I've been in the wellness community for about 21 years. I've been saying for 20 years now, saying if we could prove that the products work, that would then build the stability of somebody believing in the products long term. When I saw the company 18 months ago was when I first saw it, got introduced to the company. I then said, this is an absolute winner. So what it does then is allows us to, basically take a test, and that's the key. This gold standard test is the key to this program. The development and the science of the product, okay, nobody will walk into your practice and say, I have the second best products available. I know that our products are scientifically formulated. They do the job that we know they are designed to do, and that's working through the cellular structure, which is where I've been working for 20 years now. What I find, okay, is that you connect the customers to Zenzino, to our company. We will then pay the trailing commissions, okay, or rebate commissions. And it's very simple. 10 customers, you get 10%, 20 customers, you get 20%, 30, and so on and so on. You get up to 100 customers, you're getting 30% rebate. The beautiful thing is we have what we call a refund kit. So we allow our wellness professionals a refund pack, which is called the Wellness Professional Kit. That's $1,395, and that actually gets you 14 tests and 14 bottles of the product, okay? And what that does is once you connect 25 subscriptions, so people that are consuming the product, to the company, we will refund that to you 100%. So you get 100% margin there. Then also on the product itself. So that means you're buying that and that for $100 Australian. Your retail community out in the field is about $259. So you have a margin of $150 per customer, patient you see, okay? And also you have the opportunity of getting 100% refund on your initial output or investment. So from my side, we have basically from 30% to way up to 200% margins built into our product. And again, it's all based on your commitment, the wellness community's commitment to the company on how much of that rebate you want to get back. But we've built it there, and I have a number of practices now with over 100 customers purchasing directly from us, and that model is working 100% perfectly.
Beautiful. And I think what I loved about it, Rob, is that when I do a test for somebody, and this has come up probably about a month ago, I had two in 1 week, whereby they were already in balance. And it sort of shocked and surprised me because, we know that 95 to 97% of people are sort of out of balance. So it really showed me the integrity of the testing. But the company has a policy whereby there is a full refund, right? If they come into balance, when they've purchased a kit, they actually get a full refund because they don't actually need to do the intervention. So that for me was amazing because, the testing is the power. The testing shows people where they're at. And if they're in balance, then great. We don't need to let them take the product, right?
And that's our refund policy, and it's very important for you guys to understand. We're a 30-day money-back guarantee program. So I say to all of you guys, okay, 29th day, if the customer's not happy, you just call me and I'll gladly just hit the refund button for you. I don't want a dissatisfied customer. I want happy people, okay? And if they're not happy with our products, I'm 100% day 29, it's done, okay? Not that I have to do it very often, okay? But there are some people out there that happen. And with the test, that's why you guys have got the best of the both worlds. This test, okay, 100% guarantee. If they come in with balance, okay, 3 and under, they get 100% back. So literally in practice, I'd just send you another test. That's the simplest way around it. Or if the patient has already paid through the system, through our system, we'll just refund it straight away. That's our guarantee. That's our support mechanism to the company, to help you guys, just to feel very, very secure in everything that you're advising people in the clinic.
So I also just wanted to ask probably the last question of the day, because I know a few people have had to go, with regard to, oh my goodness, the questions is gone, Rob. Look, don't worry about it.
We have a good product for that. Called brain fog.
Oh, it was a really good question too. Oh my goodness. It completely slipped my mind. But essentially, I really love this company. I really love the quality of the product. I love the fact that we can test, and it is wonderful to have that support. The drop shipping model for me was really important because, like you, Rob, I just do a lot of my my sessions online now, and I don't want to have the worry and the expense of having to stock all of that. So I appreciate you. Oh, that's what I was going to ask you with regard to cost, with regard to TGA and cost. So could you just talk a little bit about what a kit would cost somebody, what it would retail for, and what they're actually paying for it? And then also, can you just touch on the TGA side of it, because this is a food-based nutritional, right?
Yeah, so we're categorised under the sports nutritional food here in Australia. We chose that route, okay, obviously because basically predominantly we're an oil product, okay, oily fish as they would say. So that category suits us here in Australia. But as we do move, and Dr. Paul has alluded to other products that are coming now, okay, the Extend Plus, that's on its way in. He spoke about Viva Plus, okay, that's on its way in. This is an old box. I don't have a new box of this one, but Protect Plus is on its way in, and the Ascent range. These are all the capsule, that's a capsule range, and the new range of products that are available. Also, guys, if you want a copy or need a copy or would like to read it, just please, through Cherie, if you want a copy of these books, let me know, okay? These are great reads for you. It gives you a good understanding, okay, about where we're at with Dr. Paul. He has got a new book in that he's just released. I am trying to get copies of that into Australia. So the TGA side, we are working on that. We work with all regulatory bodies. I've done that for 21 plus years in my space of the wellness community. We have some of the best consultants here in Australia getting all the approvals for us. We're targeting January 2021 for those products, okay, to be in Australia. So they're the additional ones. You'll see that there's a whole lot of rebranding, okay, of our product as well, compared to what I call the 1980s bottles, okay, like Mum's cod liver oil in the old day. Probably you don't remember what cod liver oil is, Cherie, you're that young, okay, but we're now, the marketing department has really stepped up the game as the company is growing around the world. From our side, okay, the cost of the product,
price, yeah,
the cost of the price, $13.95 for the wellness practitioner kit. That's to get started for you, okay. Obviously, as I said, full 100% refund based on 25 customers or subscriptions being connected to the company. On that, the customer, okay, on a monthly basis, they buy a professional kit or what they call a premier kit up front. That is $230 for the first 2 months supply. Then thereafter, it's $48 a month plus $4.50 shipping for the consumer or for the customer. So an all up 6 to 8 month trial is what I call it. Test on day 1, test on day 120, and then you get some tests after that the company can purchase or the customer can purchase, is about $520 for an 8 month supply. So on that, your rebate again, okay, is 10, 20 or 30%, depending on where you're at in connecting customers to our company. So strong margins again, and I'll talk about that, today. It's just to give you we're here. We know what we're doing. We're a publicly traded company. We're a full on-the-ground operation here in Australia, which is very important for you guys. Customer support is a phone call away. We have 18 hours a day customer support, 5 days a week, Monday to Friday, obviously. And then obviously if you do need something urgent on the weekend, as I say, I'm here to build the wellness community, and that's what I'm available 7 days a week to help. You guys in particular, and Cherie would verify that 100% with her calls that she loves calling me on the weekends.
Oh, Rob, that's so fantastic. Well, look, thank you so much for taking the time out, and Dr. Clayton, who's probably had to step away and get ready for going to bed. I really appreciate the time that everyone gave to this call today, and we'll be getting the recording round to many people that couldn't get on the call today. So appreciate it, everybody. Thank you so much, and we'll catch you next time.
Absolute pleasure. And again, Cherie, thank you so much. And wellness professionals, thank you so much for coming on and sharing your time with us today. We will get this recording posted out to you. Anything else you need, my email and my details are there. Please make connection with us, and I will make sure that we service you 100%. Thank you so much, Cherie, and Dr. Paul, that's gone away to put his fluffy slippers on. Thank you, guys. Take care, God.
See you. Thank you. Bye now.
Guys.